The MPCCC is a network of Victoria's largest public and private cancer health services, with Monash University's world-leading research and education united by a shared vision to advance cancer care through research.
Well, it emerged more than a decade ago, really out of need. It was clear that patients in our region were not receiving the same sort of equitable access to cancer treatment as patients diagnosed in other parts of the state, and we knew that coordinated research efforts would improve that.
There's a disparity across the state. I think some of the time patients don't even realise they're missing out on some of these opportunities.
I wonder how many folk inflicted with cancer have access to the treatment I was lucky enough to receive. What about those folk who live a day's march from the city? I was very lucky. Is my neighbour going to be so lucky?
The MPCCC is bridging the gap between research advances and the availability of the benefits of those advances to the wider community.
The most important thing is that the right person gets the right drug at the right time for them. And MPCCC gives us more information to be able to make that right decision.
Prior to joining the MPCCC, we didn't have those contacts with the Biomedicine Discovery Institute at Monash University, and now we have a very strong translational program, particularly in organoids and xenografts.
It's just so important to have clinicians and researchers come together to collaborate, to find the synergism, both in terms of offering state-of-the-art clinical care for our patient, access to clinical trials and research programs, but also that ongoing communication and dialogue, which I think is invaluable.
One of the most innovative and exciting aspects of MPCCC's work has been creating and supporting a community of molecular oncology fellows. So these fellows represent each of the major health services in the MPCCC network, and they work very closely and coordinately together.
I think our weekly molecular tumour board is a really good example of how we take the research information we've been given and change those into clinical results.
It's been a really valuable learning experience, getting the opportunity to present at the molecular tumour board, develop a deeper understanding of the molecular drivers of both rare and common tumours, and get the input from the scientists and other clinicians.
I've benefited from the discussions we've had in the MTB and to draw upon those cases as well to guide treatment of my current patients, whether that's engaging in a clinical trial that has been matched up to a previous case in the MTB, or a compassionate access program, for example, which I would not have been aware of without the MTB.
I can provide clinical excellence partnering with the MPCCC. Patients who haven't got standard of care, where I need to actually test their tumour to see what their mutation is, I've got that up my sleeve.
It was about 18 months in total before I actually got someone to say, that's what you've got. I'm under a team at the Alfred, and as part of that team, MPCCC looked further into it. It's going that extra step. It's found what I've got and has found the discoveries.
As we break down the barriers between clinicians and between scientists and between geneticists, every time you do that, you end up getting better patient care.
These fellows are gaining knowledge that they'll carry with them for the rest of their careers, which will serve them and the patients that they care for in 5, 10, 20 years' time.
I think the MPCCC has really evolved just over a few years. When we established ourselves, we just had single lines of communication between our partners, but now we have networks.
The most exciting aspect of the next iteration of the MPCCC is its very specific focus and indeed substantial investment in building networks and close connections between key metro centres and outer metro and particularly regional services. Previously, those patients wouldn't have had that sort of access, but now they will.